Somiba, Titena Mikoma, Bebe, Isorio Bindia, Wamo Benite Sonangu, Bebe Yasunga.
Radio Equinoxe 93 FM. La fréquence positive.
In a world where water and food can be deadly, one disease has been a persistent threat to global health for centuries. It is a silent killer that strikes without warning, claiming lives and causing widespread suffering. Today, we'll be taking a closer look at typhoid fever, a disease that is preventable, yet a major health concern in many parts of the world. Good day, ladies and gentlemen. This is the program You're in Your Health, aired on Equinoxe Radio Multimedia. It's always a pleasure having you on the program. And before introducing our guest for the day, let's have Lucy, my co-host. Hello, Lucy. It's a pleasure having you on the program always.
Sure, Immaculate Forgo, it is a pleasure, and good afternoon to all our listeners and viewers out there.
Today we'll be having as guest Dr. MUVALA Marcel. He is a medical practitioner. Good day, Doctor. It's always a pleasure having you on the program.
Good day, Madam. The pleasure is equally shared.
Today we are looking at typhoid fever. What's it all about and how is it caused?
Typhoid fever, like you rightly said, is one of the main challenging problems that we're having in the community. It is an infection that is caused by a bacterium, the Salmonella bacterium. Now, this bacteria actually get into the system through contaminated food or water. So there are two types. You have Salmonella typhi that causes the severe form of typhoid fever. Then you also have the Salmonella paratyphi that causes the milder form of the infection. But both infections are spread through the same means and produces similar signs and symptoms.
Talking about the signs and symptoms, how can I tell someone is suffering with typhoid fever?
Once you come in contact with this microbe and start developing in the system, the initial signs and symptoms is limited to the gastrointestinal tract because it's a gastrointestinal tract infection. Most patients will complain of abdominal pain, diarrhea. Some of them can have complications like constipation. And then in some few days, they will start with headache, nausea, and vomiting. They will lose appetite. And most of the patients too will also complain of muscle ache and general body weakness. These are the primary symptoms. But as the infection progresses, other complications can set in, and more complex signs and symptoms can also be witnessed.
How is the disease actually diagnosed?
Yes, the diagnosis is not difficult from the signs and symptoms. But most patients, when they have these signs and symptoms of typhoid, they think that is food poisoning, and they don't feel like it is something that they really need to go for medical finding. But from the signs and symptoms, a medical practitioner can tell you that, no, this is a symptom or a case of typhoid fever. But there is a need for the patient to go to hospital where medical diagnosis can be made and the bacterium actually diagnosed. So we have many tests that can be conducted in the hospital. Sometimes we send patients to do the culture test. They can send stool or urine for culture. And then there's another deeper examination, that is the bone marrow test. That is a bit complex and give a more reliable result. But we sometimes depend on the antigen antibody test. If the patient, they can send blood sample to the lab for analysis. So in some cases, even if the lab result still comes out as negative, with the clinical signs and symptoms, we can start the treatment for typhoid.
All right. Before we continue, Emma will give out the numbers to those who like to participate or ask their questions. On today's edition, we have 670-547049. I repeat, 670-547049. Or you can join us via 656-622222, 656-622222 at the end. And now, back to you, Doctor. I would like to know, how does the Salmonella typhi bacteria spread, and what role does hygiene play in the transmission?
Yes, like I said in the definition, is one of the infection that get into the system easily because it is a fecal-oral kind of infection. It means that when you pass our stool, the people that are suffering from typhoid, they pass our stool, and the stool come in contact with water or food. Anybody that eat or drink that water is going to contract the infection. So hygiene actually plays a very important role. But I want to also reassure our listener that the transmission is not only through food and water. Sometimes somebody can go to the toilet and they maybe contaminate the doorpost or the door handle. Then if you pass there and touch it and then you go and consume anything without washing your hands, you also risk picking the germs. But the most common way through which the typhoid bacterium is transmitted is through contaminated water and food. So when you eat food from sources that you are not really sure about how the food was prepared, or water that are not well processed that we consume that can be contaminated with the germs, we have the high risk of getting this infection.
Now, you just made mention of how to better prevent this condition by making sure your food is well prepared and also the type of water you drink. How then can we treat someone who's suffering with typhoid fever?
Yes, the treatment starts with the diagnosis. Once the patient is presented with the signs and symptoms, because most patients, they always have high temperature. So when the patients are presented with these signs and symptoms that I highlighted before, then we send the patient for laboratory confirmation. And once it is confirmed, there is a treatment protocol. It is very true that the bacteria is becoming very resistant nowadays, not like before that the common treatment they used to give antibiotics like ceftriaxone or even Cipro. Cipro was one of the treatment of choice for Salmonella typhi, but because of resistance now, we always ask patients to go in for culture so that we give the precise antibiotic that can really help the patient. So we have many antibiotics, like I mentioned some few. We have ceftriaxone also work well. We have Cipro, we have cefizem, then we also have azithromycin. But culture and sensitivity tests can help us to be more precise. And then in severe cases, we can also give a steroid like dexamethasone, because this is a situation where the patient is having inflammation in the gastrointestinal tract. So we need something to also help to reduce the inflammation. Then we advise patients to rehydrate themselves, especially for patients that are having diarrhea. So in some cases too, you might have patients that are having constipation. There is that belief that typhoid fever cannot just be handled with pharmaceutical treatment, and patients know that even after their pharmaceutical treatment, they might need to go for some traditional help. So there are some few traditional helps that actually help. There are some that medical experts that are very conversant with it can advise them to take the pharmaceutical drug alongside with the herbs. But I think that the choice of the treatment actually is supposed to be in the hands of a trained practitioner.
Besides being a medical doctor, you are equally a Tradi practitioner, and you just mentioned the fact that some people opt for traditional herbs. Is it advisable that for someone who has been treated in the hospital with the normal drugs that we take, then go to a Tradi practitioner to get these herbs? Because some people believe typhoid fever cannot be cured in hospitals. How true is this myth?
Okay, yes, it is actually true. My experience with the treatment for typhoid fever, but I always advise that once a patient is diagnosed, the first thing is to go for medical treatment. Yes, because in some cases, some patients, after the medical treatment, the signs and symptoms can actually disappear, but they are still carriers of the germs, and they can still even infect others. So, but the choice of traditional treatment, like I said earlier, depend on the hands of a trained practitioner, because we have natural medicine, like we have ginger, we have turmeric, we also have natural medicine like bitter kola. Yes, but the combination of this treatment, because they are natural treatment, like I mentioned of garlic. Garlic is not supposed to be boiled, but some people boil it. Once they tell you that it's good for inflammation, it's good for bacteria and even virus, and then when you take it and boil it, you lost the property, and then the patient will not actually benefit from it.
What about ginger?
Ginger also works excellently, but you can't boil ginger. Yes, the component there is not so fragile like in garlic. Garlic, the zinc property S outside there, that is the medicinal component, is very fragile, and when you boil it, you destroy it, and what the patient is drinking is just nothing but water.
Wow.
Yeah.
All right, so when typhoid fever goes untreated, what are some potential complications that may arise?
Yes, thank you so much. I was happy when Madame Immaculate started with she said that is one of the conditions that is actually plaguing the community, but many people still are not aware that typhoid is a very deadly disease. Once you are infected with this infection, you need to take the full course of the treatment and go back to the hospital where the laboratory tests can be conducted. and we see that you are free or negative from the infection, because the complication that can come after is always very deadly. So we have respiratory tract complication. Some patients will end up with pneumonia, some of them will end up with bronchitis and severe respiratory tract condition that is difficult to handle. The neurological complications too are also there. So the meninges might be inflamed. Then the patient will end up with meningitis, with brain tumor, and then you see most of the patients, they can go into a serious crisis that they will not recover at the end of the day. And then one bad thing about the Salmonella typhi is that it attacks almost all the organs of the body, especially when it's poorly treated, even when the patients are not having the signs and symptoms again. So these germs, they go and settle in the heart. They cause valvular condition, valvular inflammation.
Doctor, we're coming back to you. I have a call on the line. Hello.
Good afternoon,
Good afternoon, sir.
Yeah, I have a question for the doctor.
Okay, go ahead.
What is another thing for that a common man can really understand what he's suffering from? Have you got me?
I didn't get your question clearly, please.
Yes. What is another name for typhoid so that a common man can really understand what he is or he is suffering from?
You got that question?
Yes, I got the question. Okay, thank you so much, sir. Yes, another name for yes, another name for typhoid, they also call it enteric fever. Enteric fever because it's a gastrointestinal infection. That's how you get the infection. But like I said, with time, it can also spread to other organs of the body. It can also enter the blood. It appears in the urine. It means that it can take the whole body. So when they say that somebody is suffering from an infection of the bacterium Salmonella typhi, or like I also mentioned of the paratyphi form, that is the paratyphoid that is caused by Salmonella paratyphi, you can also describe it as enteric fever.
We're talking about Lucy. You were talking.
Yeah, we were talking about if typhoid is left untreated, what are some potential complications that may come up?
Okay, yes, I was saying that another serious complication is when the bacteria reaches the level of the organs. So we have had many cases of patients that have kidney failure as a result of poorly treated or previous untreated typhoid infection. So you see that it is really a condition, but many people don't really take it serious. When they say that somebody is suffering from typhoid fever, they think that it's just a mild kind of infection that can even resolve without treatment. So we want to reassure the population that once you have this problem, make sure that you go to the hospital where after your treatment you can go for control and be reassured that the condition is over.
We have another call on the line. Let's take this caller.
Yes,
Hello.
I want to ask if somebody who is suffering from typhoid, and that person lost conscience, and that person lost his conscience.
You got the question right?
Yes, I got it. Thank you so much, sir, for your question. Yes, the patient can go unconscious because we say that there's a phase of the...
Yeah, go ahead.
There's a phase of the infection that the germs actually affect the nervous system. So when they affect the nervous system, that I was talking of a case that the patient can end up with meningitis. It means that the meninges are inflamed. So once the virus, the bacteria reach the level of attacking the nervous system, the patient can at one moment lose consciousness. And then also for us to understand that it's a germ that when it enters in the system, it causes blood toxicity. So if the toxin in the blood reaches a certain threshold, then the patient can risk losing consciousness at the moment.
All right, and now we know that typhoid is a public health concern in Cameroon. What role do vaccines have to play in the prevention of this disease?
Yes, vaccine is actually very important in the prevention of this disease, and it's something that I don't really hear people talking about, the vaccination of typhoid. Yes, we have, there are many types of vaccine. The vaccine that are given to children, and then we also have the adult form, especially when people are traveling out of the country and going to an area where this infection is also widespread. There's need for vaccination. So we have the typhoid vaccine, you have the typhoid attenuated vaccine, we have TIPA, and then we have CIVAC that is given to children, but it's given to children above the age of 6 months. So it means that below 6 months, the child cannot take the vaccine. And we know that children are very prone to this kind of infection and also travelers. And then for adult vaccine, we have the inactive vaccine, that is the TIFA. This one is given, is the injectable form, and it's only given to adults and children above the age of 2 years. And then we also have the another vaccine, the live attenuated vaccine that is also given for. That one is in the tablet form. So those who are traveling mostly take the tablet form. That is the Typhoid that is given. But one thing that we should understand here is that when you take the first dose of the vaccine, it actually offers the protection, but there is always need for the booster dose. So depending on the type that is administered, they will tell you when you can come for the booster dose. So if you don't come for the booster dose, after that period of time, because there's some of the vaccine that can actually protect you for 4 years, there's some that can protect for more than 4 years, there's some that can protect only for a few months, especially for those that are traveling. So they would really need to go for the booster dose.
Now, we have some people in our neighborhoods who often attribute the consumption of cassava fufu, commonly known as water fufu, as a major cause of typhoid fever. How true is this?
Yes, that is something that is not medically really proven, because we understand that it is an infection and there is a germ that causes that infection. Now, sometimes when some people, like I said earlier, some people can have the infection, but the signs and symptoms are really dormant, it's not really active. There are certain food that they can consume and they go and aggravate the symptom. And they feel that, no, it is because they consume the cassava or what. No, that starchy food, at the end digestion of starchy food is sugar. And most microbes flourish where there's sugar. So those who are conversant with eating starchy food, their blood is always high in glucose. So that sugar, at one moment, if the sugar increases in the system after taking those starchy food, then it can actually activate the germ that was a little bit dormant. Then at that moment, when the symptom is disturbing, they think that the starchy food or cassava and whatsoever is the cause. No, it doesn't cause typhoid.
Okay, it's almost time. Before we end this program, we'd like you to give the last word, maybe for someone who's watching who is currently suffering the problem of typhoid fever. What advice do you have for this person?
Yes, we want to reassure the population that this is an infection that is actually preventable. So since it is a preventable infection, hygiene remains the vital step to take it in the prevention of the spread of this infection. And then those who are also taking care of typhoid patients should also be aware that they need to be washing their hands constantly, and there is also need for them to go for medical checkup. And then those who are also on treatment, after their treatment, even if the symptoms disappear, there's need to go back to the hospital to be sure that they are not remaining as carrier that are symptomless. So there is always need to go for medical confirmation to be sure that you have completely dealt with the bacterium. So this and more are the things that I think that our patient should understand, and those who are not yet infected should consider the different steps of prevention very, very important, and vaccination remain the most important preventive measure for typhoid fever.
Dr. MUVALA Marcel, General Practitioner, thank you so much for your time.
Thank you. The pleasure is shared.
Equally, thank you, Lucy, for being part of the program
Always
today.
a pleasure.
And that's what put a cap to today's edition of the program. You're in your health on Equinoxe Radio Multimedia. Stay with us for more interesting programs on Equinoxe Radio, of course, Equinoxe Television. Have a blessed day.